Joining us for a special episode this World Liver Day, we have Padma Shri awardee Dr. Arvinder Singh Soin, Chairman, Institute of Liver Transplantation and Regenerative Medicine, Medanta, Gurugram. Dr. Soin leads India's largest and one of the world's most successful liver transplant programs at Medanta. He has performed over 3,600 liver transplants in both pediatric and adult age group, with 95% success rate, performing almost 20 to 22 transplants a month. Thanks a lot for joining us, Dr. Soin. Does the etiology of liver disease vary region to region in India? And what are you seeing as the main cause of chronic liver diseases? How can we work to maintain a more sustainably healthy liver throughout our lives?
So in adults, there are four main reasons why a liver can go bad. The most important of those is something called non-alcoholic fatty liver disease, or NAFLD. So that means people who don't even take alcohol habitually can actually get bad liver damage. And that usually happens because of uncontrolled diabetes, obesity, bad lipids or dyslipidemia, or in common parlance, high cholesterol. And also poor lifestyle, where people are sedentary, they don't move, and they have lots of fried food and sweet food. So those are the four main causes of non-alcoholic fatty liver disease, which in itself is responsible for 30% of serious liver disease and liver cancer. The second most important cause is alcoholic liver disease, and that accounts for about 20 to 25% of the cases. And then hepatitis C and hepatitis B account for about 10 to 12% cases each. And there are some rare liver diseases that account for the rest of the liver disease burden. Now, if one understands the causes, then one knows how to prevent liver disease and liver cancer. I keep saying liver cancer because unlike the other organs of the body, liver cancer actually arises in a diseased liver. Like kidney, bone, breast, all these cancers arise in previously normal organs. This is not the case with liver cancer. Liver cancer only happens to those people who have a bad liver from one of the four causes that I spelled out earlier, or any other rare liver disease. So if the liver is diseased or has cirrhosis, then that is the kind of liver that will develop liver cancer. So if you're preventing liver disease or chronic liver disease, you're also preventing liver cancer. So the way to prevent it is obvious. Don't take too much of alcohol. Make sure that one is immunized against hepatitis B. And of course, live a healthy lifestyle, control your diabetes, weight, and lipids. So it's said very easily, but it's difficult to do. And that's the key. You have to, if you follow what I just said, believe it, believe it or not, 80% of liver disease can be prevented.
Is there any kind of regional-wise data we have, or anything which differs the pattern of liver disease? Differs in India itself. Just if you have anything like more alcoholic people or non-alcoholic or fatty and sedentary lifestyle is more in such urban cities. Is anything like that the same, doctor?
Yeah, so there is just a little bit of variation between the rural and urban population. The rural population tends to have the alcoholic liver disease more often, whereas the urban population has an equal divide or a slight preponderance of NAFLD compared to alcoholic liver disease. Of course, both are a problem, but the existence of a fatty liver is a much bigger and wider problem. In fact, you'll be surprised to know that 1 in 3 of us adults will have a fatty liver. And 10 to 20% of the people who have fatty liver will eventually develop serious liver disease. And about 2 to 4% of these patients will develop liver cancer. So that's how serious fatty liver disease is. And unfortunately, it is prevalent everywhere, but slightly more in the urban population compared to rural population.
So that brings me to the next question. In India, there is a disproportionately low number of organ donors. Right now, we are, as per WHO, the liver diseases, we are the 10th largest country with liver disease. That's what WHO says. So in India, though by government of India has implemented the National Organ Transplant Program in 2019, they have allocated a budget of 149.5 crore for promoting diseased organ donation. Why is that we don't have the increased number of organ donors? Like, where is the lack?
So the fact that we have very low number of organ donors in India is a very, very sensitive point with all of us transplant surgeons. We all wish, and of course the patients wish, patients who suffer from organ failure and die for the want of organs, everyone wishes for the organ donation rates to be higher. And just having a national policy and allocating a budget doesn't cut it, obviously. I mean, to give you a perspective, about 2.5 lakh people develop serious end-stage liver disease every year in India. About 50,000 of them have liver cancer. Only about 2,500 people are able to have liver transplants every year in India. The waiting lists are close to 20,000. Now, this kind of differential between demand and supply is obviously mainly due to the fact that there is a lack of donor organs, but also the reasons are financial and access to expertise for liver transplantation. But the poor or low organ donation rates are a very big reason for the low transplant rates in India. Now, why is that so? I think that, first of all, the government has to back up the launch of the organ donation program and allocation of the budget with actual programs on the ground for spread of awareness about brain death and the possibility of organ donation after that, and the fact that a single person dying of brain death in a neuro ICU, if that person's family agrees to donate their organs, he or she can actually save 9 or 10 lives and change another 20 lives. Just this fact. And also the fact that brain death is equal to death. So donation after brain death is absolutely on. It's not like a brain dead person is going to come awake or come out of a so-called coma, because it's not coma. Brain death is death. So these are the two simple facts: the success and the need of transplantation, and the fact that brain death is death, and therefore donation after brain death means that you're saving lives instead of burning or burying those organs. These two pieces of information need to percolate down into society at all levels, at all ages, in the rural and urban population, in the main metros and tier 2 and 3 cities, everywhere. And that effort cannot be made by doctors or hospitals or NGOs. It has to be a governmental effort, right? Because of the widespread nature of this awareness campaign that is necessary. That is one. The second is that hospitals need to adopt the policy of mandatory declaration of brain death. So if somebody in a neuro ICU seems like they are brain dead, then it should be mandatory for the clinicians in the ICU to try and certify brain death. And of course, if the person does not meet the criteria for brain death, then they're not brain dead. And then mandatory required request, which means if somebody is proven to be brain dead in a neuro ICU, it should be essential to ask their family for organ donation. They may refuse. So these two things, hospitals practicing mandatory declaration of brain death, and 2, required request. That means family must be requested for organs, I think are the 2 tenets which are going to lead to an explosion in organ donation numbers, even with the limited awareness that the Indian public has.
We don't have enough organ donors. So what is the difference between live donor, live transplant, and diseased donor, liver transplant, especially the survival rates? And in India, which transplant is done more and how it is seen?
There are 2 kinds of liver transplants. One is deceased donor transplant, the other is living donor transplant. And I and my team started this for the first time in India in 1998. Both kinds of transplants were done 23, 24 years ago now. And both are done in India, but unfortunately, there aren't enough deceased donors available. So that's why the predominant form of liver transplantation in India is live donor liver transplantation, which is about 80 to 85% of the cases. Now, in terms of how you do it is of course very different, because if there is a deceased donor, which means a brain dead person in an ICU, after taking permission from the family, this person undergoes a surgery. Although they are brain dead and therefore clinically dead, they undergo a surgery just like a normal surgery. The organs are removed, they are preserved, and they are preserved up to a point where they are needed for transplantation. Then they are transported to wherever they need to go to, and then they're used for transplantation. So that's how it works. In living donor liver transplantation, what happens is that a person related to the patient, that means it has to be a family member, who is blood group matching. That means either a universal blood group of O or the same group as the patient, will donate half their liver. And this person has to be 18 to 55 years of age and should not be overweight, because if they're overweight, if you remember, people who are overweight will have fatty livers. So fatty livers are not good for donation. So 18 to 55, family member, not overweight, matching group. Such a person is evaluated for 3 days for suitability for donation. And then subsequently in a surgery, they donate half their liver to the patient. The patient's entire liver is completely removed. So the part that goes into the patient and the part that remains in the donor will both grow to normal size by the regenerative process of the liver within about 2 months. And the donor is discharged in 5 or 6 days, and the patient is discharged home in 10 to 15 days. And in our institute at Medanta, we have a success rate of about 96% for the patient and complete safety for the donor. And it is a misconception that the success rate of deceased donor transplantation with a full liver is better than live donor transplantation. It's actually the opposite. The success rates with live donor transplantation is about 5% better than cadaveric or deceased donor transplantation. The reason is very simple. The living donor is a very healthy person who's evaluated in detail for 3 or 4 days, whereas a dead person is a dead person. So obviously they had a low BP and they had some medicine and they had some infection at the time of dying. So their organs may not be of pristine quality, unlike the living donor organ. And the amount of organ received, amount of liver received by the person does not matter that much, as long as it is at least 0.8% of the person's body weight. And that 0.8% can happily come through the right side of an adult liver in most cases. So that's how partial livers from living people actually work slightly better.
So now, as we see that there is a lot of technology in China, and the science is changing the organ transplant, and for, as you say, that a lot of living donors, as far as the liver transplant is concerned, is happening. So what kind of new things have come in liver transplant surgery when it comes for technology and the role of robotic surgery, and how it's like helping? Is it helping? Because in liver surgeries it's limited, that's what has been said. So if you can just throw light on that, doctor.
So I'd like to point out 3 specific new technologies in liver transplantation that have come into being, and we fortunately have been the pioneers in all 3 of them in India. And the first one of these is ABO incompatible transplantation, whereby a person with a different blood group from the recipient can actually donate half a liver. And with special treatment we call immunomodulation of the recipient over 2 weeks, we can actually make the recipient accept this different blood group liver with a more than 90% success. So that's the first innovation that has now been incorporated into routine practice and is very successful. The second is robotic liver surgery, and we are among the pioneers in this country and the world for robotic liver surgery. And basically what happens in robotic liver surgery is it's only for donors at the moment. The normal cut for a donor surgery, whereby half a liver can be removed, is across the abdomen in an inverted L fashion, starting from right here and running across on the right side. Whereas in robotic surgery, we make 3 or 4 small little holes, about 8 to 10 millimeters, through which we use fine robotic instruments to operate. And when the half of the liver so this is the liver, and when the half of the liver that needs to be, this half, the right half, is separated and it's ready to be removed, we actually remove it through a suprapubic incision, which means below the belt, above the pubic bone, just the same place where ladies have their cesarean section scar. So it's removed from a 10 centimeter incision from there. So for the donors, robotic surgery is a big boom. And every family walking into my office now wants robotic surgery for the donor, because you don't see a big scar on the tummy, and the scar itself is very small, pain is less, muscle cutting is less. So the recovery for the donor is better, although safety and success are the same for robotic and open surgery. But yes, donors love it. And the third thing, which I'd like to point out at this time, is a new protocol that we at Medanta have developed for liver cancer. Usually advanced liver cancer patients, unfortunately, are written off by liver doctors saying that, they can't have surgery, they can't have transplant, they can't be cured. But we have evolved a protocol, which is published in scientific journals, whereby a patient with advanced liver cancer, which has spread into the main blood vessel of the liver, the portal vein, can be first treated with radiotherapy protocols that we have developed and then transplanted. And now we have saved scores of such patients, and several have lived to 10 or 12 years now, which was unthinkable for a patient with advanced liver cancer. So these are the 3 innovations that we are particularly proud of, which are helping patients.
So also, I have not asked anything about COVID, but I want to ask one thing. During COVID time, the Ministry of Ayush has been reiterating that Giloy is safe and does not produce any toxic effect. And many have gone in and they've been drinking. And there is a scientific study published in the Journal of Clinical and Experimental Hepatology, and they have specified that mindless consumption of Giloy might contribute to liver toxicity and drug-induced liver injury. So there's kind of a lot of clutter in this. What is your view on it? If you can just tell our viewers about Giloy and why should or shouldn't we take it?
This is not conventional allopathic medicine versus Ayurvedic or herbal medicine session, and I by no means want to belittle or demean anything that the Ayush Ministry has said or the physicians practicing that system of medicine do. I mean, full respect to them, because I don't understand that system of medicine, and I have myself taken refuge in Ayurveda at some points in my life. But I must say that as a liver specialist, I've had the occasion of unfortunately dealing with several cases of terminal liver failure in patients who've consumed large amounts of Giloy or Guduchi. And this has happened especially in the last 2.5, 3 years since the pandemic began, because there's been some notion among people that this is preventative for COVID. To be precise, we've had nearly 20 cases of bad liver disease or liver failure, which have been attributed to Giloy. We've lost 6 of them. We've transplanted 2 of them. So, but that, I don't know the denominator. Maybe thousands had it and only 20 came to us. So, like I said, this is only semi-scientific. I have seen patients of liver failure and treated them. But I would definitely exercise a word of caution for people who have Giloy and Guduchi, because it can damage your liver if taken in excess amounts.
So what kind of new technology is coming in? If you can just talk about, I know you've seen your presentation on lab-grown or bioprinted solid organs, which we are working into, clinical trials going on into it. So what is the future we see in the liver transplantation side? Can we expect lab-grown, liver organs coming in some time, Doctor?
So yes, our lab is researching 3D printed organs. We are also researching immunotherapy or immuno-oncologic research for liver cancer. So on the 3D printing side, yes, several groups in the world have been able to produce small little livers which are 3D printed. And these are initially going to be used for testing of new medicines and drugs. So if they have human liver cells or hepatocytes, or even if they do not have human hepatocytes and they have, let's say, swine or murine hepatocytes, they can be used for drug testing and toxicity of drugs, and we see the changes in the cells that are exposed to these new drugs. So that is one significant area where they can be used. But then once we figure out how to reestablish the entire blood vessel system and the biliary system in these printed out organs, we can theoretically print out bigger organs where we use scaffolds from either animal livers or cadaveric livers or artificially manufactured scaffold. Scaffold is like a basic framework on which the liver cells are populated. So this is an area of intense research, but I don't think that there will be a 3D printed organ for transplantation available very soon. It might take 5 to 10 years.